All right, hello everyone. Today is Monday, December the 2nd, 2019, and I wanted to spend a minute and do just a quick update on where I am in my recovery after having my patellar tendon on my right knee rupture while playing a tennis match. At the same time, again, I broke my wrist bracing the fall, but that's irrelevant. This is doing well, by the way. More importantly, the ruptured patellar tendon has been doing really well. So if you've been following these videos since I started doing them, I started doing them basically right around a month ago today at this point. So a month in, where am I currently? So today was my 5th physical therapy session, and it went really well. So I was doing these videos every single day up until right at 3 weeks, only because they became a little kind of monotonous. It was kind of the same thing because I wasn't really going, I was kind of plateaued there for a few days, in other words, so I didn't want to be redundant. But the last couple of days have been just incredible in terms of getting back to being a functioning human being again. Well, what does that mean? So for a month, I've had to have help using the restroom, eating, taking a shower, you name it, going up and down the stairs. I can't drive or couldn't drive, sleeping with braces on in elevated positions, or not sleeping at all. Just you name it, down a hand and a leg. You just have to think about it that way. But for the past couple days, and especially today, I've been completely independent. I've been able to get out of bed on my own. I've been able to bathe on my own. Been able to eat on my own. Been able to walk up and down stairs, drive, get out and do things. So it's been, for me, the greatest part about the past 2 days though was setting my personal best on flexing the leg. So if I say flexing or flexion, this is the leg straight. If we had it straight out, flexing it is this way. Extending it, if it was already flexed, we would extend it this way, right? So currently on my 5th day of physical therapy today, I was able to flex the knee almost to 90 degrees. I got it to 89 or 88, 89 degrees. So it was almost a complete right angle. So that's great. I'm not using the crutches anymore. So I'm walking on my own. Again, I walk with the brace fully extended, but I'm able to walk at a pretty good clip. I was walking around today with the wife doing a little bit of pre-Christmas stuff for the 5 kids. So anyway, so that was nice. I started leg extensions today. Not on a machine, but with weight strapped to my ankles. So I was able to do leg extensions from pretty much a 90 degree down to and up. Those were, I'm not going to say excruciating pain, but they were painful. But I was able to kind of push through that. So how does the knee look now? How does it look? Okay, well, here's how it looks. So this is, of course, the healthy leg. Okay, so healthy leg, injured leg. So normal kind of flex to 90 degrees. So this is at a 90 degree angle. Okay, so straight, 90. So both these legs were identical about a month ago. Well, the injury happened on October 22nd, 2019, but I had the surgery on November the 1st. Anyway, so healthy leg, injured leg, how far can I bend it? Okay, I'll try not to use my hands. Let's go. Come on. Let's get down. Let's roll. What? Let's go. Come on. Boom. So right here, I'm going to think it's about 70. So it's hard for me to get it up there on my own. Let's see if I can get further. Okay, so now I'm pretty much at a 90 or right there at it. Let's see if I can unbrace and relax. And I can. So it's a pretty big deal for me. But that's how it looks. You can tell my quad over here is much bigger than my quad over here, but I'm aiming to get that back in a hurry. The wound looks pretty good. And again, sorry for my funky cast. It's my tie-dye choice. But all in all, I really do hope to return to the tennis court. And it's been a month. I'm hoping 3 more months, if not sooner. But again, I don't want to go through this again for sure. So all in all, I'm doing really well. So if you're watching these videos, I'm gonna get this out of the light. I don't know if I can get it out of the light, right? So sorry for that. But in terms of if you're having this injury and you're maybe not even putting weight on it yet, don't be alarmed in a sense, because it's totally normal. I've been talking with people in this where their doctors don't want them putting weight on it for a month, or some of them were putting weight on it only a couple days out of surgery. So everyone's different. But just for me personally, the last couple of days, I have felt like a human being again. So psychologically, I'm a lot better. Being trapped, in a sense, inside and not being able to work. In essence, I coach tennis and then play it often or every day and at a high level, and coach at least I hope a high level. And it's tough to have gone from that to being just boom in here, and then having 5 kids that all play and train too, and just being stuck here, boom. So that was a culture shock, especially when you were just in terrible pain for the first few days. That was rough, but and then having to kind of have someone help you nonstop, you begin to kind of become humbled in a way, and then I guess you kind of find yourself kind of institutionalized in a way in your own head, going through what you're going through, and then you get kind of angry in a sense, or at least I know I kind of went through some frustrating times, but the past couple of days, I feel like a human being again. So all in all, I'll do another update, maybe a week, or maybe if something changes, but right now I'm independent, walking, positive, ready to get back out on the court. So I hope as soon as I can get this cut off, which should be like another 2 weeks or something. I mean, it's good, but it's just precautionary. When I get this cut off and I can hold the racket, I'll be back out on court from a coaching perspective, and then hope to be back playing within 4 months. So that's the goal. But 1 month out, boom, good to go. Let's go. That's how we get down. Just kidding. I had a good day at physical therapy. It was exciting. So that's just me. Self-motivation is the key for me. So anyway, I have my snow cap on. It's here in Alabama, but it got down to I think 42 or 44 degrees last night, and it's like 55 and windy outside. So anyway, I'm sticking with the snow cap. So take care. See you later. That's it. Adios. Peace.